Prophylaxis. It would seem that a very great deal could be accomplished along prophylactic lines in handling this greatest of venereal scourges among women. The problems to be met readily fall into two classes. 1. Those for which the physician is solely responsible. Too much stress cannot be laid upon the importance of absolute asepsis in the treatment of gonorrheal cases. The physician should be scrupulously careful as to his hands, gloves, and instruments. All instruments should be boiled before and after use on a gonorrheal case. All secretions and dressings from a gonorrheal case should be properly gathered in some receptacle, a paper bag, and later burned. The utmost care should be taken in regard to the use of pessaries. No pessary which has been worn by a patient should be used by another patient. If in the adjustment of new pessaries several have been used in order to obtain a satisfactory fit, the other pessaries can be boiled, if the style permit, or thoroughly cleansed with soap and water, soaked in bichloride 1 to 500 for an hour or more, and finally returned to the stock. The lubricant used in vaginal examination may also be a source of danger. The old, uncleanly method of a stock jar of Vaseline or soap suds should be condemned, and a collapsible tube or bottle used instead. 2. The second class of problems to be met is that in which the patient, as well as the physician, plays a part. The youth of both sexes should be instructed in the physiology of sex and the importance of personal chastity. The growing girl and young woman should be informed of the danger of gonorrheal infection, that it may be contracted from dirty toilets, towels, douche tips, and intimate outfits. Oftentimes, the family physician can impart such information. The infected woman, whether she be innocent or guilty, married or prostitute, should be warned as carefully as possible of the infectiousness of her condition. The physician who clumsily imparts such knowledge and breaks up a marriage relation is often more culpable than if he had left matters alone. All are agreed that where the harm has occurred, the added wrecking of the home is not likely to help matters. Gonorrhea and marriage. It is before marriage and with the knowledge of an existing infection in either the man or the woman that the physician should speak. This question arises much more frequently on the part of the man contemplating matrimony than the woman. Statistics state that 80 to 90% of men have or have had gonorrhea, and yet of these, how large a percentage marry, do not infect their wives, and have healthy children? It would seem that the percentages of cures among men was relatively high, and the sterility due to gonorrhea relatively low. Among unmarried gonorrheic women, the majority belong to the prostitute class, and this class is notoriously sterile. It is seldom, if ever, that the marriage consideration comes up with these women. But the physician is occasionally asked to pass on the marriage eligibility of a woman who has had a gonorrhea. How shall he advise her? Ignoring the fact that public opinion says that this woman has not the same right to marriage as her gonorrheic brother, the physician must pass on each individual case as an entity. If the woman can pass the requirements stated above, the physician may assure her that she is reasonably sure of not being in an infectious state. If she has previously had an endometritis or salpingitis, the liability of sterility on her part is very great, and the physician should frankly lay this before her.